Welcome to 26 Minutes with Dr. Warren Siegel on the ZorMed Show. I'm Dr. Warren Siegel, and I'm excited to bring you today's discussion. With us today is Dr. Michele Soto from South Brooklyn Health, and we're going to be talking about a very timely topic, the flu vaccine. It's great to have you here, Dr. Soto. Thanks so much for coming.
Thank you for inviting me.
So tell me a little bit about the flu. What's going on?
So the flu is this virus that can cause a lot of infections. People think, you know what, it can be a cold, but it can be a lot more severe than that. It can impact anyone, children, adults, and it could be really serious for somebody who has a lot of chronic conditions because it can trigger things like asthma, it can trigger their diabetes, make their sugars go out of control. It can increase the risk of having a stroke, having a heart attack when you're sick, because it's not just having a cold, it can be more severe, like getting hospitalized for pneumonias. So it can be something pretty serious for someone with multiple chronic conditions.
Wait, so if I get the flu, it's not a really bad cold, it's actually a different disease?
It is a different disease. It can be mild, but it can be pretty severe. So what we want to focus on is trying to prevent the wild, severe form of the flu that can really impact your health. It can do things like keep you out of work, keep the kids out of home, making you sick so you're not with your family and friends because you're trying to avoid getting them sick. Now around the holidays, it can keep you from enjoying the festivities because you're sick and you don't want to get everybody else sick. So we want to make sure that we do whatever we can to prevent getting the flu.
You use the term triggers your asthma, triggers your diabetes. Well, what do you mean by triggers? It doesn't give you asthma, it doesn't give you diabetes, does it?
No. So if you already have it, if you have a chronic condition, it can worsen it. So someone who has asthma, even if they're well controlled, it can make the asthma worse. It can get you from having well controlled asthma to getting an exacerbation, having to go to the emergency room for more advanced treatment of your asthma. If someone who has diabetes, although it won't give you diabetes, it can make your sugars go out of control, because when you're sick, you may not want to eat. So it may make your sugars go low, or it can get your sugars to go high at the same time. So we want to make sure that if you do have chronic conditions, we want to keep you from getting sick. Your immune system may not respond as well, so you may end up having a worse version of the flu.
So is there a way to prevent getting the flu? Should I be taking more vitamins? Should I be drinking more orange juice? How do I prevent getting the flu to begin with?
Number one way to prevent the flu is making sure you get your flu vaccines. We want to make sure that everyone 6 months and older get the flu vaccine, and this is the time to get that vaccine. Flu season starts in the fall, and it runs all the way through usually in the spring. So we want to make sure you get vaccinated as early as possible so your immune system can wake up, can be ready to fight if that virus does show up. Now, that's not the only way, but that is the best way. Other ways, we want to make sure that if you're sick, you're making sure you're using hand sanitizers, you're washing your hands regularly, you're covering your cough, covering your sneeze, use a mask, stay away from people who are around you so you don't get them sick, you don't spread it to anybody else. Try to keep your family in a different space from you so you don't get them sick. So those common ways of prevention that we learned during the COVID pandemic are still relevant. We want to make sure we continue using that. But the number one reason or number one way to prevent getting the flu is getting the vaccine.
So who should get the vaccine? You said 6 months and up. Is there an upper limit? At some point, are you too old to get your vaccine?
You're never too old, and I think the older you are, the more at risk you are for getting sick. So we want to make sure you get the vaccine the older you are. Children are at risk because their immune system is a little weaker. We want to get them protected. So we want to get them vaccinated. Adults, even if you don't have any chronic conditions, we want to get you vaccinated so you don't get those around you sick. And it can become an inconvenience if you get sick. We also want to make sure that any woman who's pregnant gets the vaccine because she is at higher risk of getting complications. So anyone pregnant should get the vaccine with no concern for having side effects from the vaccine. We want to make sure that anyone with a chronic condition, asthma, diabetes, heart disease, congestive heart failure, any history of cancer, that they all get their flu vaccines. And those are not the only conditions. You should speak to your provider, but anyone should get the vaccine with no upper age limit. And as you're getting older, you should be able to get a higher dose vaccine.
So that's interesting. It sounds like what you're saying is anybody 6 months until death, everybody should get a flu vaccine.
Absolutely. Everyone should get the flu vaccine. I got mine.
And I got mine.
Good.
So that's good. Now you did mention it starts in the fall. I don't know what you think, but with climate change, I'm not sure when the fall starts anymore. I'm not sure when spring starts. I'm not sure when winter ends. Is there a difference between where you are in the United States? I won't talk about the rest of the world, but where you are in the United States about when you should get your flu vaccine?
So there is some of the areas in the West Coast can see the virus a little sooner than us in the East Coast. But in the East Coast, we're not seeing as many cases right now. The numbers are starting to climb, the flu cases. They're seeing more of an outbreak in the middle of the country, but the expectation is that our numbers are going to be increasing. Last year, our numbers went up at around this time of the year, and they peaked in the middle of December, so right around the holidays, and then by the middle of January, the numbers were starting to come down. But this is when we're seeing the bulk of the disease, so we want to make sure that we get vaccinated as early as possible so we can get protected.
It's interesting. As a pediatrician, we've always said vaccinate before Halloween. Do you think October, November, is that a good time to get your flu vaccine, or should you do it earlier, later, when you're going to be around family for the holidays? What's your advice?
I recommend in October, as soon as it's available. If we can get it late September, early October, let's give it time so the immune system can wake up. It takes about 2 weeks for our immune system to really start responding to that vaccine we get. So we want to give it the time before we start seeing a lot of the flu circulating in our areas.
And how long does this flu vaccine last?
So we're expecting it to last throughout the flu season. Most people, really a 6-month period is a good window. Most of the cases start really going down by February, March, and we don't see as many cases of the flu.
So why do I have to take it every year? I've been getting my flu shot since I was a little kid. But it's every single year. What's with that?
So it's a new virus that comes around every year. The virus change significantly throughout the year. So as we're at the beginning of the year, we're starting to see what's happening in other parts of the world. Our team makes vaccines in the US for us based on what they're seeing. Those vaccines come to us usually around late August, early September. They become available to really predict what they think is going to be coming to us in the US. That vaccine is made predicting that time period from the fall through the spring. Even if you get your shot, let's say you get your flu vaccine in January, should you be getting it again in September, October? Absolutely. It's a different vaccine. The vaccine has changed. So you do need to get the vaccine every flu season. And depending on when you get vaccinated, if you get vaccinated kind of late, it may seem like you're getting it twice in a year, but it's a different vaccine.
So it's a different vaccine because it's a different flu virus. Yes. That's really very, very helpful. So even if I were to, get my flu vaccine in February or March of 2023, I should still get another flu vaccine in October, November, December of 2023. So even if it's in the same calendar year, I should get a new flu vaccine. Is there a downside of getting 2 flu vaccines in the same year, or is there a downside of getting flu vaccines too close together?
So no, there's no downside. It's a different vaccine. It gets made new every season, so we're getting a booster. Unfortunately, our immune system will react for a short period of time, and we need to kind of wake it up again in the next flu season because it may not respond to what we had with that prior vaccine.
You mentioned some chronic diseases. You talked about asthma, diabetes. What about people who have, I don't know, HIV, or are on chemotherapy or radiation, or have cystic fibrosis or dementia, Alzheimer's? People who really are very ill, should they still get a flu vaccine?
Absolutely. They're the ones who are at higher risk of getting sick, of getting hospitalized if they end up getting the flu. So we want to make sure that they're getting the vaccine as early as possible to make sure their immune system has time to build up the defenses. We want to make sure that anyone who has one of these chronic diseases, whether it's cancer, they're getting chemotherapy, radiation therapy, they have chronic kidney disease, cystic fibrosis, like you mentioned, they should get vaccinated because their illness can become worse if they get sick with the flu. Anyone who lives in a congregate setting, like a nursing home or in a facility for adults or children with chronic conditions, they need to get vaccinated. We want to make sure we protect them. They may not be able to respond as well if they get sick.
You make this sound really easy. You just drive somewhere and get a flu shot. Where's the best way to get a flu shot?
So go to your provider. Call your provider, ask your provider for the flu vaccine. They will have it. Many pharmacies carry the flu vaccine. If you're insured, your insurance will cover it without any cost to you. If you're uninsured, please look for places where you can get vaccinated. In our health system, we vaccinate all the patients that come through our doors who want the flu vaccine, whether they have insurance or not. We offer the flu vaccine to our patients.
You said something earlier that I thought was interesting. I get a flu vaccine to protect me from getting sicker, even if I get the flu? Did you say that? Or did you say I get the flu vaccine to prevent the people around me from getting the flu?
So getting the flu vaccine is both to protect you and those around you. We want to make sure that you're protected so you don't get sick. Now, you can still get sick if you get the flu shot, but it's going to be a milder form of the infection. So it doesn't mean if you get sick that you did not get the benefit of the flu vaccine. Yes, you got the benefit. It's a milder form. There are some rare years where the vaccine and the virus that's circulating in the area do not match up. And in those situations, we may see people getting sick even though they got the shot. In this year, we're expecting that's a better match. So the vaccine that we're getting is protecting us as much as possible from the circulating virus. Now, we want to make sure that we're protecting those around us. Those around us may have conditions that we may or may not know about, and they may have a worse course of the illness than we are. So we may be young and healthy, and we think, you know what, nothing's going to happen to me. But if I get sick, I may get my mom sick. I may get my elderly family members sick.
But if they got their flu shot, then I don't need to get my flu shot because they're already protected, right?
Well, unfortunately, if we're bringing the flu home, we're more likely to get them sick even if they got their flu shot. So it's not just getting the flu shot. We still want to protect them by making sure we get protected, and we use all the the mask usage whenever we feel like we have a cold or we're sneezing or coughing. We want to make sure we're covering ourselves so we're not sharing and spreading germs, that we're hand washing. I cannot stress that enough, hand washing. Soap and water. If we don't have that available, hand sanitizer, alcohol-based hand sanitizer, so we can make sure we're not spreading.
So one of the things I hear so often is, I got the flu shot and I got sick. I got the flu from the flu shot. Is that true?
No, the facts are that is not true. So you may still get sick. We mentioned when you get the flu shot, that doesn't protect you 100%, but it will boost your immune system. Now, when you get a shot, you do, as your immune system is waking up, you may find yourself feeling a little down. You may get a little achy, some malaise. You may feel like, you know what, I wasn't feeling like this yesterday. Most people will be feeling like that for maybe a day or two, and then they go back to normal. So it's a very mild reaction to your body responding to the vaccine. When I get my flu shot, I'm able to come back to work the next day and continue my day as usual. Some people do have a slightly bigger reaction and they may need to take some Tylenol when they get home. Some choose to take it on a Friday so they can be home and rest the next day. But in general, most people tolerate the flu vaccine quite well.
It seems like we're developing more and more shots, more and more vaccines to keep people healthier and healthier and healthier. People really getting healthier, or are they just taking a lot more shots?
Vaccines have given us an opportunity to fight infections. There was a time when vaccines were not available and people were dying at young ages from avoidable or preventable diseases. So the vaccines are giving us this great opportunity to really survive. I mean, we saw this with the COVID pandemic. Once the vaccines were available and people were getting vaccinated, we saw the number of people dying go down dramatically.
So is this something similar? I mean, can you die from the flu?
Unfortunately, yes. It is estimated that up to about 52,000 people die each year from flu-related illnesses.
52,000?
And that's probably an underestimate.
Wow, that's in the United States, or
In
is
the
that
United
worldwide?
States.
That's incredible. That's a lot of people. 52
Yes.
from the flu or related. So
Illness.
what does that related mean? That they had other diseases?
So they may have had other chronic conditions that were unfortunately worsened by getting the flu. So people who get the flu, it may go, as we mentioned earlier, from mild to more complicated symptoms, including pneumonias. You can start with a viral pneumonia, a superimposed bacterial pneumonia that may trigger things like strokes and heart attacks in patients who already have underlying health conditions.
But you're saying that all they had to do was get a flu shot and it decreases the likelihood that that would happen. That's really amazing. You mentioned pregnant women. You said it's safe if I'm pregnant to take the flu vaccine. Does it help the baby?
It protects the baby. By making sure that we protect mom, we're protecting the baby, because those fighting agents that mom was able to create get passed on to the baby. The baby cannot get the vaccine for the first 6 months of life, so mom is able to transmit a lot of her fighting ability through the breast milk to the baby.
So if I'm pregnant, I get a flu shot to protect myself, my unborn child, and protect my child when he or she is born up to 6 months of age, when he or she can get the flu vaccine. I get the flu vaccine to protect the people around me. This seems so simple. So why don't more people get their flu vaccine? I don't get it. It seems so simple.
I think there's a lot of misinformation. There's a lot of fear. People are afraid of needles sometimes. And, it hurts a little. It's like a little pinprick, but it's very brief. I always recommend put a little ice once you get home. You will feel better. We give vaccines to our kids all the time when we take them for their checkups. Sometimes they get 5 or 6. So we expect for there to be a little pain, and we think the vaccines are good for our kids. We want to protect them. So I think we need to really look at how can we protect ourselves so we can be well for the family. So getting that little pinprick can be really helpful to maintain safety and health throughout. We want to make sure that we're getting ourselves protected and everybody else around us. Now, why else don't they get vaccinated? I think people heard that someone got sick when they got the shot. So there's that fear, well, if it's going to get me sick, well, it's possible that that person was sick from something else. It had nothing to do with the flu. It could have been a cold, a common cold. It could have been COVID and not the flu. So the flu vaccine is only going to protect you from the flu virus. It won't protect you from any of the other viruses that's circulating around. It's just one thing to fight.
It's interesting. I one of my favorite things to say all the time, and I say it all the time, is the only vaccine that doesn't work 100% of the time is the one you never took. But even if it works 50% of the time, I take those odds in Atlantic City or Las Vegas in a heartbeat.
Absolutely.
But there must be some side effects. There's got to be some side effects of the flu vaccine. What are the common side effects that we should think about?
So most common side effect, a little achiness where you got the shot. So usually the arm's going to be a little sore for about a day. People may find themselves, they're a little run down. They feel like they have some of the sniffles. Some people feel just a little more tired than usual. Those are the most common. Very rarely, in about 1 in a million cases, we do see Guillain-Barré syndrome, which is a condition that affects the muscles. And it can be a pretty serious condition that can be progressive, and the person may need to be hospitalized. It is a very rare condition, but when it does happen, the person does need to seek medical care because it can be extreme.
So how would I know if I'm at risk for developing Guillain-Barré syndrome? How would I know if I'm at risk for developing one of these side effects that I don't want to take the risk to get my flu shot?
The reality is we don't know. If the person has had Guillain-Barré in the past, that would be the most likely way of knowing that they are at risk. Other than that, we just don't know. But it's very rare, about 1 in a million cases.
Okay, so let me see if I get this right. I should get a flu shot. I should get it every year, not the calendar year, but I should get it early in the fall before the flu hits my zip code, whenever that is. I should get it every year because it's a different vaccine that targets a different flu virus. When I'm sick, I should go find those masks that we all hated to wear, but we did very, very well during the pandemic.
Yes.
And take those masks and wear them whenever we're not feeling well. What about the people on the subways? What about the people on the buses? Should I just be wearing a mask through the winter time? Because, I take public transportation and I see people who are coughing and sneezing. You think that's a good idea?
I honestly think it is a good idea. There's no downside to wearing a mask because you're protecting yourself and you're protecting others. There's a lot of different viruses and other infections that are circulating around that can be spread through coughing. So by you wearing a mask, you won't be inhaling those particles of virus or bacteria, including tuberculosis. So yes, I would recommend wear the mask when you're in the subway, when you're in large public spaces. That way you can protect yourself.
So the flu virus is inhaled? Is that how you get the flu?
So that's one of the most common ways. You can inhale it through your nose, through your mouth. But if you get exposed to it and you have it in your hands and you're touching your eyes and you're eating with your hands without washing your hands, you can ingest the virus that way as well. So you want to make sure that you're washing your hands before you're touching your eyes or touching your face.
So that's that hand washing or the hand sanitizer.
Yes.
Is there something I can do besides getting a flu vaccine, or maybe in addition to getting a flu vaccine, if I'm in contact with somebody who calls and say, hey, listen, we went out to dinner the other night, just want to let you know I'm sick, I got the flu. Is there something I can do? Is there a medication I can take once I've been exposed?
Absolutely. Call your provider as soon as you know, or as soon as you start having symptoms, because there are antiviral medications that can be taken, and the sooner we start taking the antiviral medication, the better. It can be taken as a preventive dose, or if you already have the symptoms and you're sick, you can take the full 5-day course of the treatment.
So are these pills that I take, or
Pills.
is it a shot, or what do I do?
These are pills, pretty easy to take, very low side effects, but they work best when you start taking them immediately as either you get exposed or you've had symptoms.
So I go to dinner with somebody Saturday night, they call me on Sunday, Monday, Tuesday. How many days can go by before I can start this medication?
Ideally, 2 days. No more than 2 days, because by then the illness will probably have taken its course on its own and would have started to improve. So the sooner that we can get started on the treatment, the better.
So it sounds to me like there's something I can do to prevent the viruses, particularly the flu virus. I can wash my hands, use the hand sanitizer. When I'm sick, put the mask on. I can get my flu vaccine as early as possible. I think you said there's no time that's too late to get the flu vaccine. If I'm exposed, if I know I'm exposed to somebody with the flu, I can call my provider and possibly start medication within 2 days, even if I feel perfectly fine.
Yes.
Wow. This, again, seems so simple. Not sure why people don't do it more. I see every time I go to a pharmacy, I see that they give out flu vaccines. Is that safe? Is it the same vaccine that you get from your provider, or do I absolutely have to come in to see my provider? Can I get it at the pharmacy?
Go to your pharmacist. If it's hard getting an appointment with your provider, go to your pharmacist. They can give you the vaccine. It's the same vaccine. They are trained to give the vaccines, and the sooner we can get you vaccinated, the better.
This is wonderful. Is there anything else you would like to tell our audience? This show is about being healthy, staying healthy, or making slight changes to be healthier. Is there anything else that you'd like to share with us this flu season?
In general, maintain good health, good eating habits, exercise habits, sleep well to maintain a good immune system. If you like taking vitamins, go ahead, continue taking your vitamins. But make sure that you do get your flu shot. As early as you can, get that flu shot. It's never too late to start, so today is the day to get that flu shot. And then take regular precautions.
What does that mean, regular precautions?
So, as we mentioned earlier, hand sanitizer use, wash your hands, make sure you're wearing a mask if you're starting to feel sick or if you're around someone who is sick. Now, the holidays are coming around the corner. If you're around family and friends and you see somebody that's coughing, it may not be a bad idea to wear a mask while you're not eating. And then make sure that you try to maintain some safe distance if you can not be as close to that person who's been coughing or sneezing, because we just don't know what it is.
Very helpful, and it's just common sense. Really appreciate you taking the time to be on the show today. Thank you so much.
Thank you.
And that brings us to the end of our program today. We sincerely thank you for tuning in and for learning alongside all of us. For more information about our show, please don't hesitate to call us at 718-510-2103 or visit us online at www.zurmed.com. Stay updated, stay engaged with South Brooklyn Health by visiting our website at www.nychealthandhospitals.org/South Brooklyn Health. This broadcast was proudly brought to you by Brick Media in partnership with South Brooklyn Health. Until we meet again, stay informed and stay well. Thank you.